In the previous videos we talked about the concept of fairness, which we assume playing a hidden role in anxiety disorders. This video will be about the treatment of this concept. The problems with the excessive need for fairness are represented with self-sacrifice and punitiveness. This and the next video will be about the therapy techniques for them. We will talk about cognitive, experiential, behavioral and therapy relationship approaches for both schemas. With the cognitive work of self-sacrifice schema, we focus on the change of exaggerated perception of how needy and blaming the others are. And we also try to increase the awareness of one's own needs using cognitive techniques. Here let's have a look at George's way of living with the people around him. George, that is very interesting that you are emphasizing the responsibility of yourself in this event. I understand that you wouldn't feel the same if you lose your license because you are a leftist.
Yes, every government creates their witches and hunts them. So having a leftist background and losing my license because of the government's intolerance, that is not a problem. It always happens like that. I can suffer but won't lose my integrity and will live in dignity.
I see. That's cool. I'm wondering that if it is similar in other areas of your life. How is your understanding of fairness compared to the people around you?
Actually, I am a very careful person about the others. I always try to be fair. Many times I find myself misused by others, trying to be fair. I know my brother is abusing my economical status, but I keep giving him money which I know I won't get it back.
Do you also lend money to people other than your brother?
Yes, a lot.
Who are they?
Well, I still pay the credit cards of my first wife, the life insurance of my second wife. Oh, I still pay the physiotherapy fees of one of my patients. I think it has been 16 years.
What is the reason for that?
She was a little child when I operated her. Because of the operation she had some movement limitations with her shoulder. I offered her parents to help them with the payments. They said yes, and I am still sending $700 each month.
For 16 years?
Yes. Her parents are divorced 5 years before. The mother calls me every month if I forget.
Do you forget it a lot?
Well, since last year I began to forget. The tone of the mother is really disgraceful. She wants the money like I owe them.
I see. I think you are trying to do your most if you have anything to do. Paying for the 2 ex-wives and brothers' expenses, the girl's treatment. There is a very strong helpful side of yours.
Now I am marrying again. As she brings her cleaning lady to our new house, I had to fire the lady that works for me.
It should have been hard for you then?
It would have. But his husband is my driver. So I added her salary to his husband's.
As you can see, give and get ratio with others is seriously damaged. Trying to be fair in many areas, he is nearly sabotaging his life. People with self-sacrifice schema has an excessive need for fairness. They try to give as much as they can, until they feel a perfect inner peace. Like the hand-washing of a cleaning type of OCD patients, these people compulsively think and behave to reach a perfect fairness level. But it seems like the fair enough button is broken in their minds. So it is useful for them to stay in not fair enough situations without giving more. Within the cognitive techniques, it is important for the clients to understand when the schema is triggered. So recognizing the schema's sensations in their body is a good start. It is important because the strong emotion and sensations persuade a person that he or she is doing something wrong. In cognitive therapy, this bias of thinking is called emotional reasoning. Here is an example of helping the client to understand what is going on in his body while the schema is being triggered. Can you remember the feeling when you had to talk with the lady that cleans your house for stopping to work together?
Well, I felt nothing actually. She and her husband will earn the same amount of money. Nothing to feel bad about it.
Oh, yes. I forgot. Then let's imagine that you are talking with her for quitting her job but not adding her salary to her husband's. Imagine her husband is not working for you. You have to stop working with her. But you won't be able to compensate the situation by giving money to anybody.
Oh, it is so hard. I feel very bad. Imagining talking with her.
Which emotion do you feel?
I feel pity for her situation.
I see. You think she is in a pitiful situation. And what is the emotion of yours?
I am responsible for this situation. I feel guilt.
What are the sensations in your body? Where do you feel them?
I feel powerless. My arms and legs are like with no strength. I feel like a child which is about to be yelled at.
By whom? The cleaning lady?
No, not her. It is like I made a big mistake and someone is just about to punish me or blame me for her misery.
Okay. Is there any similarities with the feelings at the time of the malpractice court and your current feelings?
Nearly the same. My colleagues were saying that I am reacting like a child at those times. Even when we went out for fun with them, I was sitting at a corner like I am paralyzed.
This technique about recognizing the bodily sensations can also be considered as an experiential technique. Experiential or emotional techniques help us to fight with the schema at the emotional level. Understanding that our triggered emotion and sensations are not just related with the current situation, helps us to stay in a healthy adult mode. In this way we can think, feel and behave more adaptively. In experiential techniques, our main strategy is to access the resentment over the imbalance of needs in imagery, mostly with parents. We try to find ways to protect the child against the demanding or self-sacrificer parent. Now we will see an example of imagery work with George, on a reference experience with his mother. George, can you just focus on your emotion and sensations in your body now?
Okay.
The feeling and the emotion that you experience in front of the cleaning lady, and at the times when the trial for the malpractice was going on. Can you feel it? When was the first time you have learned to feel this way? When, where, and maybe with whom?
My father was an easygoing man. I never felt like this with him. He slapped me once, but it was just an incident and he felt terrible after that. I think this is the feeling I learned to feel with my mother. She always put pressure on me to help everyone around me, especially my hyperactive brother.
And if you couldn't help your brother, what would have happened?
She would make me feel like I did something very, very bad, behaved so selfishly.
What is your need at that time? How do you like your mother to behave like? What do you need from her? Please try to talk with the child's words and tell it to your mother.
Mama, I don't want to take care of my brother. He is 2 years older than me, and it is not my job to take care of him. He is always fighting with others and causing problems. I need to play with my own friends. You are the ones who should take care of him. Please take him to a psychologist or doctor. And don't leave it to me. My friends are afraid of him and they don't want to play with me as he will come and bully them.
Did she hear you?
Yes.
What is she doing after hearing what you told her?
She is saying that she wasn't aware of my feelings. She says they will take my brother to the doctor.
What is little George feeling and doing after hearing what she said?
He feels so relieved. Like the nightmare was over. I can go out and play with my friends without feeling fear of my brother's appearance.
That's nice. I am happy for the little George. Now, can you think that little George is with us with this fear of malpractice issue? Little George learned to feel responsible for the events that is too much for him, like to take care of his brother. A hyperactive sibling can be very hard for a child. The adults had to take care of him, not little George. Little George's need is to play with his friends, without fear of problems which are so big for his age. And it is also his right to feel free of responsibility when it is not needed to. Now, as the adult George, can you say something to the little George about his fears with this malpractice issue?
Dear George, you didn't do something wrong. You even warned the chief for the complication. In this profession sometimes everything can go wrong even you do the right things. The complication occurred in the intensive care room and you weren't even on guard that night. And it could be the same even you were on guard that night. You cannot fix every situation. Our mother leaned on us very much and I know it was so hard to say no to her demands. You were always her magic boy. But you cannot do magic in every situation. You are not the answer to her problems with her other son. Like you were? Like you were? Like you were? Like you were not? The answer for the son of that poor family.
Poor George. Please take your time and feel your sorrow for your patient. That's okay. That is very nice of you, caring about your patient and his family. And it is okay to feel pain and helpless sometimes. How do you feel?
Strange actually. My feelings for my brother and mother and for my patient and his family are nearly the same.
Was it the little George feeling responsible for your patient's death?
Yes, it is him. He is always with me.
We all have our vulnerable sides with us, all the time. They just need our healthy adult to be alert against our demanding sides. George, if you feel okay now, can you talk with the little George again for his over-responsible feelings about the loss of your patient and the malpractice fear?
Okay, I'll try. Dear little George, I understand now that it was you feeling so responsible for the patient like you felt for your brother and mother. But it was beyond our limits to help the patient. I will always be here for you when you struggle with these kind of issues.
And for the fear of being sued for malpractice?
Similar situations can happen in the future. But this time I will not let you feel miserable there. With the help of the guy in front of me, I am learning to be fair to you. Nothing bad will happen to us. And even we get in trouble someday, I'll find a healthy way to cope with it. I won't let my demanding sides to punish you again.
And as the guy in front of the adult George, I will do my best to teach him to have fun with you. Deal? Here George realizes that the emotions and feelings of him about the malpractice trial is also linked with the over-responsible part of him. This part of him is so strong, as he had to deal with his brother's problems for a long time, even he was a little child. With this emotional imagery work, he will get rid of the overwhelming feelings and emotions that comes from the past. He may still feel anxious about the trial issue, but in a more healthy way. With the behavioral part of schema therapy, we try to find homeworks for rehearsing the alternative behaviors related to the schema that we are working on. For George, these homeworks may be about asking others about his needs to be met. Not choosing needy partners is a common behavioral homework for self-sacrificing persons. They can watch others' behaviors dealing with these needy friends or partners. Or at least they can try to set limits on giving to others. Assigning certain thresholds for giving is a helpful method. Like not borrowing money above a fixed amount, or not helping the other above a certain amount of time. If the client has already given so much already, the therapist can help the client to call the friends who owe to her, or him. The key point in behavioral part, is to find homeworks that are customized to practice the new learnings in the real-life situations. Using the therapy relationship is an important factor in schema therapy. We customize our relationship with the client in favor of the schema healing. With this aim we try to be a good model for appropriate boundaries. Our way of handling our needs and rights will be examples for our clients. If the client starts to take care of the needs of the therapist, it is important to point out the pattern in the session, and kindly discourage her or him from doing that. Even we build a sufficient rationale with the client about asking her or his needs met, they may not start doing it by themselves. Then we can use our therapy relationship for it. George, I see you have completed the list of the people who owes you money. Well done. Why don't we start calling them, now? In this video we checked the schema therapy techniques for self-sacrifice. In the next one we'll see the techniques for the punitiveness. So, till then, goodbye.